let's zoom out and just think in general about what health insurance is, how health insurance works in this country. In the past, I've described it as a rapacious, unnecessary mafia middleman that gets in between you and your doctor, and they price gouge you on the front end. And on the back end, they do everything they can to deny you your claim.
On this clip, Kyle Kulinski and Krystal Ball talk about the recent murder of United Health CEO in broad daylight in the middle of Manhattan. Obviously, this story has generated a lot of attention. It's it feels to me kind of right out of a Robert Ludlum novel, or the hook scene of a Bourne Identity movie. Masked man standing outside on this busy city street, pulls out a gun with a silencer and just caps a dude in a suit. And, there are engraved words on the shell casings. And then he hops on a city bike and zoots off into Central Park. To big manhunt ensues. It seems like the stuff of fiction, but let's hear what they have to say about it.
There's a United Health. It's called United Healthcare, but it's a health insurance company.
Right.
United Healthcare CEO was murked in New York City yesterday before 7 a.m. Some dude rolled up, and it was very professional looking, had a hoodie on, had a mask. I think he even had sunglasses. Bang, bang with a silencer. Dipped. Gone to Central Park.
Jumped on a city bike.
And as of the recording of this, we don't know who it is yet.
They
right?
just released.
So you said they just had released a picture, but they haven't caught dude yet.
Correct. They just released a photo that they purport to be him. And so, the manhunt is on. I mean, honestly, it's crazy he's gotten this far at this point. I mean, Manhattan, there's cameras everywhere. There's people everywhere. There's cops everywhere. So even at roughly 7 a.m. when this was all going down, that he was just able to slip through the grass was kind of crazy.
Yeah. Wonder where he went. Mm-hmm. Right?
Yep. They set up a tip hotline. I wonder what sort of tips are being
here are the tips they got. People called up and said, that's what people are doing.
They're like, I totally saw him.
Bro, I got his address. www.dickandmyass.com. Go check it out. Yeah. That's where he is.
I mean, so obviously this has sparked an unbelievable, it is pretty believable reaction because...
No, I'd say unbelievable.
You're shocked by it?
I was shocked by the extent to which the reaction was what it was.
I do agree with that because it's definitely not just obviously there's a lot of shit posting lefties. Fair enough, right? But this is a mainstream mass.
Undeniable mainstream reaction.
And the greatest proof of that, if we can put A12 up on the screen, is this is from Facebook. Not exactly the bastion of leftism. The socialist revolution, right? This is MAGA grannies on Facebook. And United Health Group, his company, posts, "We are deeply saddened and shocked at the passing of our dear friend and colleague Brian Thompson, the CEO of United Healthcare, blah, blah, blah." Okay, the reaction, though, is what you should note. So this was a while ago. They've actually now taken this post down, according to some random person on Twitter. They said it got to 21,000 laughing reactions before they just took the whole thing down. So basically everyone who's reacting to this post is doing the LOL laughing reaction to the announcement of this man's murder.
21,000 compared to, let's just be kind and say the cryings went up to 3,000 or whatever, right?
Yeah.
21,000 that were laughing at United Health being like, hey, our CEO got murked.
Well, and obviously people were immediately like, oh, there's only millions of suspects because find me an American family that does not have a healthcare horror story. Find me one.
I saw it everywhere, too. It literally everywhere. Everywhere. Doesn't matter where you went. I posted a segment on it. I waited a little bit to see if we got more information about who did it.
Yeah.
But then I posted a segment on it the other night, which was about, let's say, 8 hours after it happened.
Yeah.
And if you read the comments on my videos, and understand, yes, plenty of my audience are diehard lefties. There's also a lot of standard-ass liberals in my audience.
Yeah, that's right. That's right. Yeah, I was just looking on media. They did a post about Taylor Lorenz has actually been
she was going hard in the paint, bro. Because Blue Cross Blue Shield just announced some shit where they're like, we're not going to cover your full anesthesia for your surgery. There's a limited window, and then after that, you're on your own. So if the surgery goes over what it should, and they determine what it should be, right? If it's supposed to be 3 hours, sorry, you went for 5 hours, and I got to pay $10,000 for your anesthesia.
Which you're literally knocked out. Like, you have no control over.
So she posts here's the Blue Cross Blue Shield CEO picture.
That's wild. And so anyway, because, Taylor generates a lot of hate. And so I was curious what the reaction to this article on Mediaite, which is this sort of like, non-ideological, somewhat right-wing at times site. And every comment was like based or, the jokes that people make about like, sorry, my thoughts and prayers were denied, et cetera, et cetera. And we have some of those TikTok reactions. We could put this up on the screen. That were also indicative. So this person tweets, I think this is really the most important point. Saw mainstream news coverage about the killing of the CEO of United Healthcare on TikTok, and I think political and industry leaders might want to read the comments and think hard about them. And here's a couple of them. They say, I'm sorry, prior authorization is required for thoughts and prayers. This one says, sending prior authorization denied claims, collections, and prayers to his family. Can go to the next screen that has a few more of them. Was his trip to the ER really emergent? According to his own company, my husband's heart attack was not an actual emergency, and we were out $3,000 full deductible. It's crazy what my first thought was, and then I look at the comments and realize I am not alone. I just can't find the care. Maybe if they ask for pre-approval of my care, then after they care, they're required deductible, I might be able to supplement some care. And this one says, I can't even pretend to care. I hope he's looking up at us. So this was almost the unanimous reaction. And, on the one hand, the extent of it and the unanimity of it was pretty shocking. But on the other hand, we know this is an evil system. And it's easy to feel like, because it's so systematized, and because it's so enmeshed in society and just generally accepted and upheld by, both parties at this point, the Democrats did everything they could to block the Medicare for All reform movement that would have actually upended the industry to make it about people's care instead of profits. But because it is this giant bureaucracy, elites don't see it as this level of evil. But when you think about the number of people who've been bankrupted, who've been gouged, who've been made sick, denied care, who have died, preventable deaths because of people like this individual. When you think about all those pieces and you see this mass reaction, then you're like, well, I guess we shouldn't have been surprised.
Well, and the other thing that occurs to me, this is a little off topic, but a vigilante like this is, if you're into comic book movies, this is the kind of Gotham in which a character like Batman arises, right? Where there's a populace, it feels like there's a powder keg of unrest, and people start taking the law into their own hands. And then what we see is this enormous popular support for that, which is potentially, it feels enormously satisfying in some ways, but it's a recipe for pretty serious unrest. And, I agree with them. I'm not sure that the powers that be are really reading the signs.
Let's zoom out and just think in general about what health insurance is, how health insurance works in this country. In the past, I've described it as a rapacious, unnecessary mafia middleman that gets in between you and your doctor, and they price gouge you on the front end. And on the back end, they do everything they can to deny you your claim, to deny you money. The whole nature of the system is, let's charge them as much as we possibly can get away with on the front end, and then in order to maximize profits, deny as many as we can on the back end. And that system is literally organized systemic violence against people. That's what it is.
Yeah.
Because when you look at other developed countries, their health insurance systems, they don't have a system like we do where it's for profit, where it's capitalist. Their health insurance systems in many modernized countries it's called single payer. Single payer means the government is the single insurer, which means we all pay taxes into the government. Then when you go to the doctor, you need help, you go to the hospital, you're in trouble, whatever. It guaranteed, every little bit is paid for it. There's even some places where you don't, like when you go to the hospital, you don't literally pay a dime. You don't pay a penny. Some of them will give you money for parking, for if you're parked somewhere by the hospital, right? So I think people are just onto the fact that this is violence and that this system does not give the single slightest solitary fuck about human life. There's some things which just should 100% be outside the realm of the profit motive and outside the realm of capitalism. It's like private prisons. Well, what happens if you have private prisons? You're going to have private prison lobbyists go to politicians and try to get them to come make more things illegal, come up with things like 3 strikes laws, so you get more asses in more prison beds.
That's right.
So that you can make more profit.
Right.
So in other words, the idea of a private prison shouldn't exist. The idea of a private mercenary army shouldn't exist, because if you have a mercenary army, they're going to want to go to war to make more money.
Yeah.
There are certain things that just have to be part of what's called the commons, the public good. If you're crafting a society from scratch, at the top of the list is going to be like, if somebody gets sick, they should be able to get help regardless of their financial situation.
We have no excuse. Like, as much money and wealth is in this country that we still, and you look at our life expectancy rate. I mean, we pay more than any other nation for healthcare, and we get some of the worst results. Like, that's the reality. And it is systematized violence. And there's a real, like, banality of evil thing
and
here
that's
too.
the thing. And that's what the status quo defenders, that's what they're not really grasping, is that, hey, but there's a system in place and there's people wearing suits and ties at the top of it. And there's an organized nature to it. So, whoa, why is everybody's not takeaway just the very banal and obvious point of murder is wrong?
Right.
It's like, okay, well, let me ask you, did all these people who are reacting like this, they just wake up one day and say, I'm now pro-murder?
Right.
Or is there something else going on here that you actually have to be curious enough to dig deep enough to find out? Why are people reacting like that? Why is 90% of the reaction shit like that?
Yeah.
You know, I've been doing a couple of videos recently about Piers Morgan where people just kind of get on and shout at each other. But there is this very triggering thing for me when I hear people on the right spouting their nonsense, is there's this attitude to it of like, things are great, dummy. You're welcome. Quit complaining about how great we're crushing it. And what these two were making, you know, Kyle Kulinski outlines the healthcare thing very clearly. I think Krystal Ball puts her finger on the sort of moral thermometer of it, is that this is systematized abuse of the American people. And then we are being asked to sort of thank them for it, which it feels a little bit like this CEO murder is the response to that final insult of like that attitude of you're welcome for what does seem to be, certainly feels like, an ever-tightening vice grip, you know, on our wallets, on our lives, shortening life expectancy, et cetera, et cetera. But I want to know what you guys think in the comments. I mean, this is, you take a real pressure point like our healthcare system, which is bonkers, and then you add this kind of movie matinee. I mean, I don't mean to glorify murder. I certainly don't support murder. But the details of this, right down to the engraving, the words on the shell casings left at the scene, do feel right out of a blockbuster movie. You know, let me know what you think in the comments.